again, I want to thank you guys for coming on today. We're going to be doing a webinar about introducing short-term care to your clients, client meetings, etc. And however you're getting your clients. I know a lot of our folks come, Medicare clients or just clients in general. Or so when putting this together, we've done a couple similar to this, but my initial thought on this is when we're talking about short-term care, we've been trying to, as an office, talk to people about extended care. The whole long-term care thing, it seems like that's always been a tougher sale for folks than just hearing that. And you're going to see some of this in our presentation. But so you're really going to hear me do a push on, short-term care, extended care. So people hear, LTC, STC, they're just thinking, it just brings with it, I guess, some negative connotations, etc. So you'll hear me say extended care a lot. And so we're excited here at GoldenCare to be kind of one of the leaders in this short-term care push. More of the presentation later, you're going to see how the industry is changing. We really are shifting to more of a short-term care arena. A lot of carriers, 10, 12 years ago, we had 80 companies selling long-term care. We're down to about 3 that you can actually broker for. There's some group ones that you can have access, but essentially the long-term care market's shrinking. And as that's happening, the short-term care industry is growing rapidly. So as I go through this, just kind of keep that in mind. And introducing it, there's really not a huge difference than we've always done with long-term care or short-term care, or talking about extended care. It's just that need, creating that need is what we're trying to do. The angle here today is I just want to maybe open your eyes to some of the things that are happening in the industry around us that you would take yourself for your own knowledge, maybe not bore your clients with some of the stuff I'm about to share with you, but just so you have a good working knowledge and understanding, I guess, of what's happening out there in our country and to the extended care market. So with that, I'll go ahead and get started. Again, my name is Jeff Clark. I'm a regional director here with GoldenCare. I've been with GoldenCare for 26 years. I've written and sold over 700 long-term, short-term home health care policies. My job now is to help agents of ours game plan, design, help them research products to better fit whatever need they bring us, whether it's a married couple that are healthy in their 50s or a widowed lady that's osteoporosis and a compression fracture in her 70s. We like to think at GoldenCare we have all the type of plans you'll need, from home health care all the way up to full-blown long-term care plans. So anyways, with that, we'll go ahead and get rolling. Short-term care. First thing I'm going to say, and I say this in a lot of my meetings, is we are in this post-COVID era. And, as far as introducing long-term care, short-term care, extended care, you're never going to find a time, at least I've been in the industry for 26 years, where it's never been more receptive than it is right now. Coming off of COVID, people are terrified of going to a nursing home. They don't want to go to a facility. They know, and again, I don't want to bore you with a bunch of stats on this, but if you became sick and needed care, if you ended up in a facility versus receiving that care at home, you were 11 times more likely to die if you got your care at a nursing home or assisted living facility. And people are very keenly aware of that. 90% of married couples are going to require care. 90% of adults have never really had a discussion about long-term care. 61% of people, this is a Gallup poll, by the way, said that they'd rather die than go to nursing homes. So we've known this has always kind of been there, but COVID really brought it to the surface. And I argue that I'll just say that people are more receptive than I've ever seen. Our websites are getting hit more with people inquiring about extended care than we've ever seen. So COVID has really created a great environment for introducing this. And I promise you, your clients are just waiting to be asked about it. A lot of them want to be asked about it, but they're not. So, something like 89%, I believe, the same Gallup poll that I'm quoting here, said they would like to engage in a conversation about extended care. So again, with all of that, it's a great time. Excuse me. Okay. Also, what's going on around us is the Washington Trust Act. Excuse me. So if those of you don't know about what's going on here, the state of Washington tried to implement, and they're still trying, that's going to kick off now, they had to delay it, but a 58-cent tax for all Washington residents, that they're going to go ahead and tax them and build them a long-term care policy. So they do this by, again, taxing them 58%, $580 per 180. If you earn $100,000 a year, you're taxed $580. This goes into a fund that provides you with a $36,500 lifetime coverage benefit. Now, Doesn't sound like much, but again, 36,000 is better than nothing. There's no choice here. Everyone that works and pays taxes in Washington State is forced into this plan. They try to get off the ground. They said that if you were to buy private insurance on the private market, you could avoid this tax if you had a long-term care policy. Well, suddenly there was an incredible rush, a push of people trying to get long-term care policies in Washington. So much so that all three carriers that are currently National Guardian Life, Thrive and Mutual Omaha had to shut down taking new applications in. They just simply would not accept anymore because they got flooded. I don't know exact numbers, but thousands, tens of thousands of policies, suddenly just got, where everyone was clamoring to get it. They couldn't take it all. Washington eventually had to delay this thing. The point we're making here is that states are now faced with a lot of the problems that are coming with their own budgets, as they can't take care of all these people. And so you're seeing more and more states starting to maybe implement a long-term care fund. They call this Washington Trust Act. So that in COVID, other states, by the way, just so you know, that are talking about doing what Washington done, California, Minnesota, New York, and Pennsylvania. Watch lists as you see these ones below. So in my humbled opinion, I think more states are going to do this or do some form of this because, again, they can't afford to take care of the tidal wave. And I'm going to cover this a little bit later, but there's a tidal wave, an aging of America that's happening that's incredible. And the states just do not have the dollars to take care of them. So they're really trying to, they've done things in the past, like, the Deficit Reduction Act, the Class Act, which more or less was trying to educate people across the country into taking care of long-term care needs on your own. But as the states struggle with this, more and more are going to implement taxes. So the public awareness is at an all-time high in my experience, and it's only going to get better. So, again, the headwinds are probably less as you've ever seen in this industry. So it's a good time to maybe start talking about extended care. So, okay, let's kind of get into this now. And I have a couple different things we'll talk about. But the first of all, I alluded to at the beginning here is how do you get over this stigma, this long-term care, short-term care? People immediately just kind of shut down when they hear it. They don't want to buy it. They just, for whatever reason, the public has been just kind of turned off to it. In the past, again, I told you they're warming up. Consumers feel like it's just too expensive to get long-term care. It's hard to qualify for. And so short-term care, unfortunately, had been affected by the same misconceptions. So we recently, we do a lot of panel of experts. We quiz our agents. We have webinars where we ask for our agents' feedback on various topics. And, this summer in July, we did one. We just asked people, what are you using for your long-term care, your buzzword to introduce this to your clients? And most of them are using this word extended care. Others alternative care, nursing home avoidance, simplified issue, extended care. But extended care seems to be the most popular. And so, as we start to kind of develop short-term care plans, and you'll hear me talk about the Omniflex short-term care plan that we put together with Manhattan Life, we wanted to really build a plan that kind of focused around this extended care path. So you kind of see this as we go forward. So how do you introduce short-term care, extended care, long-term care to your clients? Well, again, not that much different than we've always done. We've created the need for long-term care in this office for 27 years. We have presentations, a missing link or the pivot presentation that do a very good job of that. Me personally, I'm just going to go ahead and tell you my own two thoughts, having sold a lot of it, having helped agents sell a lot of it all over the country. I'm a big believer in stories, not scary stats. We've all seen the stats out there, 70% of people need care, and et cetera, et cetera. I'll just steal this from one of my mentors, Mark Randall. When he would do his consumer seminars, I travel on the road with him, and eventually I started doing a bunch of them, but I took it from him as I would just tell a story to paint the picture. And I'm going to do that in the next probably 6-7 slides here, but start off when I would get in front of either people or even a crowd of people or an individual, a consumer, and kind of tell them, look, in this country, we've got a real problem coming on our hands. If we were at this point, take every single carpenter, every masonry guy, every roofer, and every sheetrocker, and if we were to take every single nail, 2x4, any building materials, and we stopped building roads, and we stopped building schools, and we stopped building apartments and houses, and we only built nursing homes, that's it, we would never be able to build enough to take care of the tidal wave of people that are needing care that are coming down the pipe. This is why if you look at hotels, hotel chains have stopped building these high sky rises, these 13-story buildings that you walk into a hotel room, you've got a bathroom on your left, and you've got this one big bed, and a TV in front of it, right? That model's kind of gone. If you'll notice, a lot of the hotel chains now, they're building these 3 or 4 level Staybridge suites, Marriott Courtyard. They have these 3 or 4 levels, 90 to 150 units or what have you. They all have their own kitchens. They have a little living room, right? You have a little living room area. You can sit down, and thank goodness, by the way, if you ever travel, there's nothing worse than having to eat pizza or eat your dinner at a hotel bed. But that's the new model. That's how they do it. And the reason they're doing this, because these hotels are going to be transformed into facilities of care. They're going to be transferred into assisted livings, into nursing homes. The companies have figured out that 10 years from now, when the building is getting older, aging, they're going to be converted into. So we can't build them fast enough, but the whole landscape is going to change. Try to imagine that when you're driving around out there and you're going to work on a Wednesday morning and you see a daycare place with all those kids out there, adult daycare, there's 2 times as many of them behind the scenes being cared for. There's such a tidal wave, and it's only getting bigger. And again, I'm going to cover this more and more. And so there's cruise lines are converting their ships into floating assisted living facilities. Why? Because they've already got a kitchen, they've got a doctor's offices, they've got laundry facilities, they've got everything you need to convert these big ships into basically floating assisted livings. So the landscape of our society is going to change because, again, we just don't have. Now, that's a story that I'd like to tell just to paint the picture of what's happening in this country, the aging and the problems we're having. We're simply running out of places to put people, and we're running out of able-bodied caregivers to take care of them all. So now, probably better than stories is maybe some stories backed with facts. So I want to kind of do that. I'm going to take some of the slides that my colleague just gave a presentation on the industry updates. And for you, the agent, these next 6, 7 slides, I don't expect you to talk to your client about this stuff. It's just something I really think you should understand as an agent. It'll help you be more of a well-rounded agent that can convey the problem, the crisis, if you will, that's coming. So we really want to set this importance of extended care. Okay, the aging of America. We've heard these stats, etc. There's 54 million seniors in America. That's more than the entire population of Canada, right? 10,000 people turning 70 every day, the boomers. Okay, so over 70 million seniors by 2030. And so this next, it's such a problem. Going with the story I just told you, if we were to build 2 nursing homes, 2 assisted living facilities that each could hold 196 people, we built 2 every day. Every one of these places could hold 200. We would still have less than half of the nursing homes we need. And that's what I'm trying to say. We can't possibly do it. We don't have any place to put all these people. It's a real crisis that's coming. And so the good news is we're not just selling nursing home insurance, right? Extended care talks about being in the home, being in assisted living facilities, and all the other options that are out there. Ideally, maybe staying in the comfort, aging at home, right? That's what people want to do, aging in place. It's a very popular buzzword, if you will. When I'm talking to my clients, I talk about how important it is to stay at home and the comforts of home. And the stats bear that out. People tend to get better in a home environment versus being put in a facility. They kind of give up on life when they're put in a facility, like they're put out to pasture or something. So the whole being at home becomes so paramount in any type of plan for extended care. And here's just some stats for you. COVID decimated the nursing homes that we already have. So the problem I just told you about is getting even worse. 579 closures in 2020, largely because of COVID. Suddenly these nursing homes, because of so many problems and deaths and the elderly population, these nursing homes were forced to buy extra safety equipment, extra gloves, extra disinfectants, couldn't put people together. It had to pay hazard pay for all the employees that work there, people quitting the nursing homes. They can't find staff. The nursing homes are in huge trouble. Matter of fact, only 3 new nursing homes opened in 2023. This was as of December of last year. So again, they're just not making them anymore as we have this tidal wave coming. Just try to imagine what this means, okay? So again, some of this thing, this aging America. This first A here is the Government Accountability Office. There's 100 trillion in unfunded liabilities in this country. Now, again, 1/3 of all states' budgets is this Medicaid thing, right? And this is, again, to help take care of seniors who have maybe been wiped out. Medicare, again, $747 billion and $728 billion for Medicaid. It's a large part of this unfunded liabilities. States are in panic mode. They know they can't take care of all these folks that are coming. They've got a tidal wave of care coming, and they just have no place to put them. They don't have money to take care of them. okay? And when you want to be like the legislative level, people are trying to fix Medicaid. How are we going to shore up Medicaid dollars? And when people, the average citizen out there thinks about Medicaid, they think about, single moms or maybe welfare people or, free meals or providing affordable housing or, where Medicaid, 75% of people on Medicaid are the younger folks, the kids, young adults, people that are struggling and are unemployed, et cetera, but they only use up 30% of the Medicaid, numbers. The senior population, they only represent 25% of people on Medicaid. They're using up 70% of those dollars. So if you want to fix Medicaid in these budgets, you need to address the seniors because that's what's going to break us, okay? All right. Other things here. Survey conducted in May of 22. 90% of respondents said that an estimated $100,000 is what you needed for 1 year nursing home is out of reach for them. 83% said that an estimated $60,000 for 1 year of assistance from a paid nurse or at home or home health care, again, out of reach for them. I know I've seen stats on this, they're all over the place, but a female can expect to spend $167,000, a male about $131,000. Those are, what to expect on, that's not including your Medicare coverage. That's what you should expect to have in extended care costs. So call it about $150,000. Okay, the burden. And this is, when I was creating the need, I guess for me, it was always a burden. I have always thought that long-term care, short-term care, extended care is more of a emotional sale. It's not one that you want to hit them over the head with these stats I'm showing you. Again, I do this just to try to educate you, but the real thing is the 53 million Americans that are currently caring for an aged parent or loved one. 2/3 of these people are working too, so it's they're being split at both ends. The immense pressure. I think of my own story. Again, stories are always good. When I was taking care of my father for about 2.5 years, and when he'd leave the hospital, he broke his back and fell again, or I have to be there 5 times a week, every day after work, and then maybe come over on the weekends, grocery shop, make his meals. I was still trying to do a full-time job. I was coaching my son's football teams, a couple of them. I had to quit coaching. I had to really scale back on a lot of what I was doing. I never saw my family because I'd leave work, I'd go to my dad's house. So it's an incredible burden you put on families. And so when I talk to people when I'm sitting down with them, I really do like to ask them about that, about what their kids are doing, who their caregivers are, what their plan is. So, but just keep in mind, again, 53 million. They have $600 billion in unfunded caregiving. In other words, these people are working for free, right? Okay, and the financial burden, and I've seen all kinds of stats on this, but you have to understand when someone's not going to work, they're losing not just the hourly wage, but they're losing money that maybe would go into their 401k. I hear stories of maybe the daughter that's quit her part-time job to take care of dad for a while, or one of the spouses has to quit their job and take care of dad, or somebody has to, and that's immense financial hit for that person. The caregiver not only suffers from depression and burnout, anxiety. It's an incredibly hard thing, doing a job and being a caregiver, but they're losing out on lost wages, lost investments. It's an incredible burden on that. And it's another one of those catchphrases to steal it from life insurance. I saw an ad, years ago. It said, life insurance isn't for the people who die, it's for the people who live. Long-term care couldn't be more true in the same thing. It's extended care thing. Extended care is not for the person who has a stroke and needs care. It's for the 3 or 4 people that are affected by it. The son and daughters that are coming over to help 3-4 days a week. The wife that suddenly now is a full-time caregiver. So it's for everyone around you, everyone in your radius. So, okay. Millennials represent 25% of unpaid caregivers. Again, that's just it's getting to be more and more. As this tidal wave comes, again, we're running out of places to put them. We're running out of people to take care of them. We don't have enough nurses. We don't have enough, health aides. So again, more of this is going to start falling on the families, more and more. And so, last thing on these stats, etc. Again, these are for you. 75% of case management providers have experienced challenges connecting patients with services. There's just a real lack of places to put people to take care of people. So if you want access to any type of quality care, you better be prepared to pay the full market rates for it or have insurance. Okay, there's not going to be a lot of handouts out there because the government is strapped. Our numbers are strapped. Our demographics, we just are not prepared to do this. Okay, so I like to ask open-ended questions, and I'm a little probably frontal on this part of a presentation, but I'll ask my clients, have you talked to anybody in your family about extended care? Who are you working with for your longevity planning? Have you discussed this with your children? You know, are your children planning on moving in with you? Are you going to move in with your kids? And then they'll say something like, well, my kids live in Oklahoma and I'm in Missouri. I can't, you know, my other daughter lives out in New York, and, you know, we are spread out as a society. It's not like, you know, 100 years ago when at least one or two of your kids would stay in the same city as you. It's getting harder and harder for folks to take care of each other. And so I don't mind asking them, are your kids moving in? Are you moving in with them? Who's going to bathe you? Are they going to take you in the shower? Is your daughter-in-law going to help you shower? And they'll say, well, my wife will take care of me. Well, you know, it's kind of irrational. Your wife's going to be 85 when you have a stroke. She can't lift you out of a bathtub or help you with a lot of stuff. So it's uncomfortable, but I don't mind asking these very open-ended questions and ask them, you know, have you discussed this with your children? And just let them talk. Or have you had anyone in your family that's experienced a need like this, nursing home or needed assisted living care? Or tell me about what happened with them. Oh yeah, on Ethel, yeah, she ended up in a nursing home and they ran out of money. Just, I promise you, if you ask that question, it'll invoke a response. Okay, so objections. Extended care they're sometimes easily overcome, especially when you're talking about using a short-term care versus long-term care. Well, price right at the get, right? And I'm going to show you this in just a second, how the prices for short-term care are very affordable as opposed to, say, our other solution, which was long-term care premiums. And I'll show you more of this later in the presentation. Health and underwriting. So, you know, people, the reason they don't buy long-term care, they think they can't afford it and they think they can't qualify for it. Well, short-term care eliminates that too. It's much easier to get short-term care. Sometimes the products are too complex and hard to understand. Again, the short-term care kind of cleans some of that up. It's a shorter, easier thing to get your hands around. My kids will take care of me. You know, that's when, again, sometimes if I was sitting down with a couple, I would ask them, do your kids make your decisions or do you make your decisions? Sometimes at the end of the presentation, they'll give you the old, I need to talk to my kids first about this. Well, I'd already kind of addressed that because I'm going to ask them earlier on, do you make your own health decisions or do your kids make your decisions for you? Okay. Rate stability. This is another whole topic, but short-term care, because it doesn't have a 3, 4, 5, 6-year benefit, a $500,000 payout, or it's capped at 1 year. There's so much less risk to that insurance company that we don't expect the short-term cares to have nearly the problems that the long-term care companies had. So much less risk to that carrier, much more of a stable product to sell. Okay, so let's talk about price here. Short-term care rates monthly. So if you look at, again, trying to price out, and I'll show you this in just a second here. I think I have some slides coming up that are going to address this. Actually, go to presentation mode. I don't know why I did that earlier. Okay. $100 a day, facility and home health care. 60-year-old person, $37. That's $100 a day. $200 a day is probably more realistic. A 60-year-old can get that for $71. Okay, long-term care, that's going to be at least $150 a month. So you'll see the rates here. There are some very affordable things for people who have waited till they're 65 or 70. They think they can't afford it. They can't get anything. If they're just even going to buy a $3,000 a month benefit, which, remember, that was what Washington State was proposed by charging you that. They're going to give you a $580 benefit. Excuse me, for $580, they're going to give you a $36,000 pot of money, $100 a day. So for a working age person that's 55, you'll be much better off buying a short-term care than going with what the state's offering you. But even for a 65-year-old that wants $200 a day, $6,000 a month benefit, it's only $100 a month. So it's not as expensive as some of the rates that you're going to see in long-term care. So again, short-term care really does kind of eliminate that price thing or helps with that. Okay. So again, I mentioned this earlier. If you're not using a presentation, I suggest you do. We have two great ones. We have the missing link consumer presentation. Then we have our pivot. The only difference between these two, the missing link just walks you through it to create that need. The pivot is able to go ahead based on some questions as you go through the presentation. It's going to allow you to pivot then, and maybe at the end, there's only going to have the products that person can buy based on the fact they told you they had cancer a year and a half ago or 2 years ago. They had maybe they've got Parkinson's, maybe they've had some osteoporosis, or no matter what the health condition is there, there's places as you go through that you click different buttons based on their answers, and it walks you down a path to at the end you only have the products, maybe home health care only or short-term care, that they're able to get. So if you're not using a presentation to create the need, I suggest you kind of look into either one of these. They're both available on our website, goldencareagent.com. We're happy to share these with you. We've got webinars that we've given these presentations so you can hear our experts give that presentation. And so that's available to you. And what those presentations will do is they'll go through the stuff that, you have to go through your client about why people need long-term care, the acute needs, the cardiac, the hip fractures, things like that, right? That's why people start needing extended care. They break a hip, or they had that heart attack, and then you've got your more, your chronic needs, Alzheimer's, chronic osteoporosis, diabetes, kidneys, strokes, cancers. So at this point, again, most clients, you can see I used to do this. I used to ask people, do you know anyone who's had cancer, a heart attack, or a stroke, or Alzheimer's? You ask those things, it's about 90% of people. So they're going to say, oh yeah, Uncle Ted had that issue, or my dad did, or so, it's very easy for people to see these needs. Okay. So again, how to introduce short-term care. Now I'm going to kind of pivot here again. Now I want to talk about the strength of short-term care versus some of our other solutions that we used to offer. And maybe that's the biggest holdup, is the thing we were trying to sell was just the wrong product. Okay. Long-term care right now is being sold with low policy amounts. We don't need to necessarily reinvent the wheel. We already know what the need is. We just have to find we've been basically selling extended care or short-term care all along. We've been doing it with the wrong product. Okay, so we went ahead and I looked at our last year, the 30 million of long-term care premiums that we sold between us and our sister office over there at AIM and Yakima. So what kind of benefits are being sold? 65.5% of the policies that we sold as an agency of our $30 million block were basically $150,000. They're between 100 and 144, or between 2 and 3 year plans. Okay. Only 15% of our policies were better than $250,000. So a bulk, almost all of what we're selling, is again little 2-year plans, 2 to 3 years. The average annual premium, by the way, though, is $2,800. Okay. So most of the clients over age 65 are buying a benefit of around 100 to 150K. Why? Well, because if you ever try to price a 65-year-old with 250,000, that premium is about $6-7 grand, right? So we can't afford it anymore, and so very few people are buying the people in the 65 and older arena. Medicare age folks just aren't buying that. They're buying $100,000 pots of money. Okay, so here's the average length of claims. So, and just think of it this way, I've said this in a lot of different ways. There's all kinds of stats on this, but a bulk of claims, a bulk of people, 80% of people aren't going to need more than 2 years of care. Okay, so the average years that people use care, any services, is 3 years. That's like maybe they started off at home getting help from their wife. Eventually, maybe they had a nurse coming out to the house, maybe a son or a daughter helping out. Then eventually got worse. They ended up in assisted living or maybe a facility. Or the whole time span on this is about 3 years. And at home, it's about usually a year. Okay, that's the average. 59% of people are right there about 1 year. In the facility, it's about 1 year. Okay, so you add that up together, depending on what combination they go from facility to care, or to home care, or home care back to facility. You're looking at 1 year, less than 1 year. So again, a bulk of people are going to be using 1 to 2 years of benefits. So why are we trying to sell them a 4 and 5 year benefit? Why are we trying to sell them $250,000? Look at the short term. This is the Omniflex I'm going to use. It's just, quite frankly, it's the best short-term care plan out there right now. There's more coming, I'm sure. GoldenCare is working on maybe with other carriers, other endeavors to maybe help other carriers bring more to market. But this particular one is with Manhattan Life. Take a look at the benefits you can buy. Okay, so if you wanted to max this out, remember it's a 1 year benefit. I can get $400 a day. Okay, so I'm just going to look at the gray line here. All right, this is without inflation, no inflation. That's $12,000 a month. That's $144,000 a year. Okay. Now that can be restored or reused one time, so it's $288,000. But with the same plan, I'm able to buy a home health care plan for $300 a day. By the way, this is all cash. It's all indemnity. So I'm going to get $12,000 cash a month, along with $9,000 cash a month. So that's now overall 244 plus 108,000. That's $252,000 worth of benefit I can buy. And the premium, this is for a 55-year-old Iowa female, age 55. Actually, not even female, it's unisex rates. Age 55 premium for, again, a $250,000 pot of money, only $90. Okay. I have other stats to show you the inflation rates, etc. But so for someone to get a $9,000 a month home care benefit and a $12,000 a month nursing home benefit, a total of $252,000, which again is going to last them about 2-3 years, $90. Doesn't that shore up most of what we were just talking about as far as the average length of care, right? So for $90 a month, she can wrap up about 80-90% of her risk. Okay, or he can, she can. All right. I want to bring this up as I in the previous slide here. You know, we talk about restoration of benefits here because in reality, yes, you get 504 total thousand. You get 108,000 and you get 144,000. Now, most of us cynical long-term care agents are saying, yeah, that there is a restoration of benefits, right? So it could, in theory, you could double that restoration of benefits. Okay, this 108,000 could be 252,000. Well, if you used it twice, it could be 504,000. And a lot of people say, yeah, but how often does that happen? Someone goes to a nursing home for, you know, a year, they come back out and they're better. It doesn't happen that much, but I'll tell you what does happen. Remember this is so important for agents to understand. Long-term care has what's called a 90-day certification requirement for a claim. In other words, if I want to do a long-term care claim, and forget the cognitive thing, if we're cognitively impaired, that's going to work. But for everything else, you know, I've got to be 2 out of 6 ADL deficient. I can't be able to perform 2 out of 6 activities of daily living for a period that a doctor says is going to be longer than 90 days. So if I were to get a hip replacement, I might be laid up for 3 weeks, maybe a month. I don't know. If I had a knee replacement, maybe I'm laid up for a month. If I had a heart attack, maybe I was laid up for, you know, a couple months. Okay. That's not going to trigger a long-term care claim, but it does trigger a short-term care claim because there is no 90-day. As soon as you're 2 out of 6 ADLs, you get a hip replacement, you go home, you can't do that on your own. You now qualify for $300 a day at home, cash. Okay. So let's just say you only have a 2-month claim, big deal. Well, you just extracted $9,000 a month twice out of your plan, okay? And then it restores again. So the fact of the matter is restoration is so big with short-term care policies as opposed to long-term care. Look at all these things I have on the screen here: knee replacement, bypass surgery, motor vehicle accident, all heart valve replacement. These are all claims for short-term care. So the restoration benefits is important in a short-term care, and it exists. Okay. So there really is a shifting market. What do I got here? I got about 11:34. Try to wrap up here in the next 10 minutes or so. This market is shifting. And so we are trying to stay ahead of that at GoldenCare. We offer you a lot of great products. Manhattan Life short-term care is great, but GTL has a short-term care. Aetna does. Wellaby has a short-term care plan now. But we offer, all of these plans also have home health care only plans. True Freedom is a plan, again, for prepaid home care. So no matter what you bring us, we have the longevity, the extended care product to help your client out. And again, just to state availability, this looks like it's about 3 weeks old, but most of the areas of the country, we're going to have a plan for you. The gray areas, we're working. We do actually have a policy that's by Chubb. It's a guaranteed issue term life that can be also used for long-term care. So if you're looking at this map and you have some clients in Florida or Minnesota, California, we've got a solution for that as well. Okay, quickly here, I just want to show you short-term care versus long-term care. And again, I like to say the word extended care, but just take a look at how, in my, you know, I've tooted the horn of long-term care for so long. And after looking more and more and designing program presentations and doing comparisons with short-term care, it's been a real eye-opener for me. Just take a look at this. Remember, Omniflex, short-term care, by definition, can only be a maximum of 1 year. You know, it's funny when you ask most agents what short-term care is, they think it's, oh, that's just for like recovering, right? Like a 1-month benefit or 2-month benefit, you know, after a hospital stay, you get, I think a lot of agents, consumers maybe don't have they're thinking short-term care is a 90-day coverage or something. Short-term care plans are 1 year. Long-term care is defined as 2 years or more. Okay, so if I wanted to sell someone a $12,000 a month benefit, okay, I could do that. I could stack it all up, $12,000 a month for 1 year. And by that comes with a $9,000 a month home care benefit. But so if I want to do this in long-term care, I could do a $4,000 a month benefit over the course of 3 years. Both of them, by the way, if you go to a facility, are going to equal $144,000. Nice thing with short-term care is you get the $108,000 built in there. So you're actually looking at $252,000. Nice combination of home and facility versus, again, $4,000 a month for 3 years is $144,000. Okay, they're both coming with a 90-day facility elimination period and a first-day home care coverage. OmniFlex is all cash. We know how strong that is, right? Complete, here's $12,000 a month, pay who you want. The daughter that's helping you out, your son that had to leave work, your daughter that maybe had to quit her job, your wife, your neighbor kid, whatever it is, it's cash. Okay, look at the annual premium on this. Now, OmniFlex comes with a $300 drug reimbursement. If you're taking, a couple generics, maybe a brand name drug, pretty easy to get there. The premiums are $1,100 versus $1,900. So I'm taking nothing away from these people, right? All I'm doing is shortening and fattening it up. If you listen to any of my presentations, I'm a big believer in short and fat. Give them all their money up front. Why make them wait over a course of 3 years? Okay. Same thing here. I'm just showing you. This is with inflation, and this is for a married couple. Okay. So husband and wife, same thing. They're each going to buy $144,000 and $108,000. Okay, so $252,000. But then I went ahead and went $6,000 a month for 3.5 years. So now I can get the same pot of money that the OmniFlex, for example, or short-term care would offer. Look at the premiums here. Again, inflation, 5% simple is the same as 3% compound if you look over a 20-year period. Okay, so the annual premium here, $4,900 versus $95. And I got to tell you, because remember, I told you earlier, most of what we're selling is around $150,000 or less. I'm getting this benefit up to $252,000. And I'm charging a heck of a lot less in long-term care. Just a much better fit for extended care. So again, if I had to ask someone, come claim time, would you rather receive $144,000 over the course of 1 year, or would you like to get $48,000 over the course of 3 years? Well, what happens if you die a year into it? You don't get the other $96,000. So, there's just, it's so much more advantageous to get it all in cash, all spread over 1 year, instead of being bled over 3 years. Okay. So the real advantage, again, claim time. So this is a stroke. Someone ends up in the facility for 15 months. Okay. So after the 90-day elimination period that both plans have, I showed you in the first example there, this person gets paid $144,000. Traditional LTC, they only got paid $48,000. And then, by the way, once you get that claim paid, the person recovers from that stroke, they have $144,000 still available again. Over here in traditional long-term care, only $96,000. But they got paid $144,000 versus $48,000. Remember, the premium is $1,100 versus $1,900. Okay, and I have some more of these, very similar. 6-month home health care claim with a fracture. Again, you're going to get copies of all these slides. So I just kind of wrap up here. It's getting a little long, but the advantage comes at claim time. Again, even on a 6-month claim here with an RN visiting 3 times a week. Okay, so your long-term care plan that you set up with them that has the, again, $3,000 a month benefit, or excuse me, $6,000 a month for 3 years, or $4,000 a month for 3 years. At $150 a visit, your OmniFlex is going to identify you for the full $300 a day for every visit. A long-term care plan is only going to pay you for exactly what they have available to you. On a long-term care scenario that we gave you, it was a $4,000 a month benefit 3 times a week. So on a daily amount, that's about $130. It works out to over a 6-month period. You get paid $21,000 with OmniFlex, only $10,000 or less with a traditional long-term care. So again, for a lot less money. Okay, so Medicare, again, introducing it. Medicare people, these are people between 65 and 75. Here's the problem with trying to sell them is they've waited too long. They can't get coverage. They know it's super expensive. They're still worried about being a burden. They're still worried about this. This is becoming acutely aware to them. They waited till, how many times do you have clients that call you that are 70 and say, yo, I got to get long-term care. My brother just went through this and People call when it's too late. And that's just the crux of our problem in the whole extended care industry. Well, now with these new short-term care plans, we can help 65, 70, 75-year-olds, okay? The older age clients, and actually now they can afford it and they can get coverage. It's a great thing. And so I really do think that the short-term care can save this industry. I won't bore you with all this stuff here, but as far as there's no catastrophic claims, so short-term care companies don't have to have these rate increases, okay? It covers a bulk of what people need. It covers them in an all-cash manner, okay? As far as an agent, there's no certifications required. It's a shorter app. It's quick. It gets issued in about 7 to 10 days. There's no certifications. Products are simpler to explain. So there's just so many things about short-term care. And again, if you have a 51-year-old married couple that can afford a $7,000 annual premium, you sell them long-term care. But I'm going to argue that for a lot of folks that we're talking to, short-term care is going to allow us to help a lot more people. And what we say around here is it lets us go back to the future and help all these 60, 70-year-olds that we used to help 15 years ago. Nowadays, it's just all but impossible to get anyone issued at that age. Well, with this Omniflex and other short-term care plans, we can get them policies and they can afford them. We can help a lot more people. It's better on the insurance company. It's better on the clients. It's better for the agent. So anyways, I hope this opened your eyes to help you do some more with short-term care, introducing it, trying to kind of get that knowledge out there. We're going to send you a copy of this, and there's this and a lot more slides. If you want more of that stuff that was really technical about unfunded liabilities in Medicare, Tom Rennell did a great industry updates, I think about a week ago, 10 days ago. That's available on our network, GoldenCareAgent.com, as is this presentation or any presentation that we give. They're all recorded, and you're able to go ahead and look at them. If you want to get one about the Omniflex product itself, about the GTL product, or any other short-term care product, they're available on our website for your anytime you want to go hop on there and do some training. It's all there. Otherwise, I really urge you to call us here, 800-842-7799. If you have a case you're working on, maybe you're not sure if it's going to be a good one for home care only, maybe it's a short-term care, maybe you thought they weren't going to be able to qualify or afford something, please let us help you. Give us a call. We're happy to help you go through it. We'll go through the different products. We'll show you the tools we have. We'll share the presentations with you. We want to help you succeed. And really, we want to help you help your people. This extended care is such a big thing. It's the biggest threat facing people's retirements today, and nothing else is even close. And so you as an agent are probably their best life raft to help them from this. And like I said at the beginning of the presentation, they're looking for help. They're looking for answers more than they ever have. So let us help you via mailings, via whatever it is, need creation, some emails. Let's work with your clients. Let's get you to sell more short-term care. I think it's a better solution. So with that, I want to thank you guys for coming on board. Again, 800-842-7799. So I'll go ahead and wrap it up. Give us a call here at the marketing office. Thanks for coming on board. Again, 800-842-7799. Have a great day.
GoldenCare is always here to serve you with new tools, new products, new ideas, and new innovations, and always the best support in the business to help you succeed. So give us a call at 800-842-7799 and check out our website at www.goldencareagent.com.